Do you know that what you eat could be affecting your mood? Today, we'll explore how the right and wrong foods can impact your mental well-being with Stanford and Harvard-educated nutrition book author, Peter Rogers, MD. Please click like to help Be Green with Amy. Welcome, Dr. Peter Rogers.
Greetings, Green Warrior, and welcome back, Dr. Rogers.
Hi.
Green Warriors, you know that what you eat could be affecting your mood, and maybe there's some other things also that you're not aware of. And Dr. Rogers is going to teach us how the right and wrong foods can impact your mental well-being, but he's also going to be talking about some other things as well that can impact that. And I'm so excited to have you back. We've covered quite a few topics with you over the months that you've been on the show, Dr. Rogers.
Yeah, it's like a semester course in nutrition.
Yes. Yep. And even just in this hour today, we're going to learn more than most doctors learn in medical school.
Yeah. Medical school is a joke. They don't learn the most important stuff. The pre-med, med school, even residency education is fake. The three most important things, nutrition, epidemiology, toxicology, they don't learn any of those subjects.
Yeah. And it's right at their fingertips if they could only know that it's there. And hopefully the more appearances that you do on my broadcast, and you have a YouTube channel and you do other appearances elsewhere, the more we get this out into the public, the more it's going to land into the physicians' brains. And maybe
I don't think so. I don't think so. I think this will always be a fringe product for just a few smart people, because there's billions of dollars that does not want this to become popular. And so it's only something that a few smart people are going to find out about. But there's every powerful financial pressure in the world is against people learning about this stuff. So, I just do it because it's the right thing to do, but I don't think healthcare is ever going to change. If you were making $1 billion, would you want your business to change to something that would, cut your profits by a tremendous amount? No way. They're not going to let it happen.
Yeah. So basically it's up to us, the individuals, to get educated, and because it's all under our control. And we really need to rely on ourselves and what we learn, rather than the medical professionals, other than if we get in a car accident or something like that.
Right. Yeah, they're good for trauma. They're good for, drain and abscess. They're good for a lot of stuff like that. Acute problems, certain high-tech fancy surgeries, kidney transplant, put somebody on dialysis. They're good for all that. But the most common stuff people are sick from is they're fat, they're hypertensive, and they're pre-diabetic or diabetic, and they've got atherosclerosis. Those are the sort of the gateway diseases that everybody has practically in the Western society. And those are dietary diseases. You can't fix them with a pill.
Exactly. And that's why I'm so glad that you agreed to come on. You've been a monthly guest, and you brought so many topics to light that we can learn about and get all this important information out to as many people as we can. Okay, so we're going to start off. We have a presentation for us, but what we're going to do is start off with our true or false game.
It's time for True or False on Be Green with Amy Live. Answer true or false to Amy's questions in the comments below, and Amy will ask our guest for the expert answer.
Okay, Green Warriors, here's the first one. True or false? Genetics can play a role in the likelihood of developing anxiety or depression. Okay, Dr. Rogers, tell us about that.
Yeah, genetics can play a role, but conventional medicine totally exaggerates genetics. They always exaggerate stuff over which the patient has no control. They always say every disease associated with aging, it might be partly genetic. Sometimes it seems due to an infection, sometimes socioeconomic disparity. And doesn't that sound nice? But that's almost always BS. You start looking at the actual data. 1 billion out of 1 billion rice eaters are skinny in the Asian countries back when they ate a rice diet. You go to Africa, in America, most of the blacks are all hypertensive, super common. 1929 Donaldson study, Lancet Journal, there was 1,800 consecutive admissions. Not a single patient was hypertensive. So what I'm trying to say is there's good reason to be optimistic. The first step to treating a disease effectively is understand what causes it.
Yeah. And even I believe in medical books, they talk about African Americans being at risk for certain things because of their heritage.
Oh, yeah. That's what I'm trying to say. It's all BS. they always want to say it's due to aging and genetics, because that means there's nothing you could do. You just have to buy their pill. They're not going to tell you, oh, it's due to high-fat diet and excess dietary sodium and excess dietary high fructose corn syrup. They're not going to tell you that, because then you could cure yourself. They don't want you to cure yourself. There's no money in that. There's no money in the truth. The truth is a rare little thing on internet interviews like this.
Well, I'm proud to represent, so that's great. And we'll get some more truth with our true or false questions. Okay, Green Warriors, true or false? The impact of food choices on mental health is often fully addressed by conventional therapeutic methods. Okay, Dr. Rogers?
Yeah, that's such a joke. You know, out of the Ivy Leagues and a few big name medical centers, you have these professors, okay? And here's the life of a professor. You know, they start out at a junior assistant level and they want to get promoted. As they get promoted, they have more status, they make a higher salary. Okay, so in order to get promoted, they got to do research. In order to do research, they need some grant money. Who's got the money? The big drug companies. So they have to kiss the butt of the drug company to get money. And the drug company basically tells them, look, if you make our drug look good, we'll give you more money for your next project. If you don't make our drugs look good, we won't do nothing for you. If you badmouth our drug, we'll get you fired. So they have to do whatever the drug company wants. The professors at the big name universities, they are owned by the drug companies. There's very little original, honest research. Okay, so they have to promote the drugs. And one of the things they'll do, and it's one of the reasons why I said it before, the most important thing is that the doctor cares about the patient. The reason a mother and a father, even if they're complete idiots with no education, no experience, poor judgment, are still the best people in the world for a child is because they love the child. And so what you've got is this atheistic Darwin system where no one could care less about the patients. Patients are like stupid peasant proles. No one cares about them. Okay, so what happens is all they've got to do is set up a research study to say that the drug works. And then they make billions of dollars. So it's like attention deficit. You know, if you sold somebody an amphetamine on a street corner, that would be against the law. But you can give amphetamines to children because you can, you know, pretend it's good for attention deficit. It's not. The long-term outcomes are poor. But they write a couple BS studies and there they go, making billions of dollars.
Wow. And just thinking about the long-term effects of these medications.
Right. It's because the patient's parents are a bunch of chumps and they trust them. You should not trust childhood psychiatrists trying to sell drugs for your kid. Okay. It's ridiculous.
Okay, we have another true or false. According to research, there's a high likelihood that individuals taking anxiety and depression medications will require them for a lifetime without achieving a permanent cure.
Yeah, there's like the best psychiatrist who ever lived was this guy named Bregan. And what he said was all psychiatric drugs cause brain damage, essentially a slowly progressive lobotomy. Okay, and he's not the only one that said it. He's a Harvard-trained psychiatrist. Grace Jackson, there's a whole bunch of other ones. Joanna Moncrief, and there's a whole bunch of other ones. Kelly Brogan, they all, you know, the ones who have sort of looked at it closely and are honest about it, psychiatric drugs are a disaster.
Wow. And there are people that are relying on them, and it's a shame. And we're going to find out a lot more about this in your presentation, and I think we should just get started with that because it's packed full of lots of important information. So we're going to get started with that. As usual, Green Warriors, if you have a question about today's topic or any kind of question as far as nutrition and other things that maybe Dr. Rogers can help you out with, please put that in the chat and we will ask him a little bit later in the broadcast. And we're going to start the presentation.
Okay, so here is a neuron, and these are brain cells. Over here is where the cell body is, where the nucleus is located. This is the incoming information coming into the neuron through the dendrites. Dendrites, like dendron, it means tree. And so incoming information comes. The neuron, when it gets a certain amount of signal, it'll send an action potential. The action potential begins here at the axon. The axon is this tubular structure that connects to the axon terminal. This is called the axon hillock. So the action potential is initiated right here with sodium channels. It then travels down the axon, opens up voltage-gated calcium channels. Then the neurotransmitter, NT is for neurotransmitter. They're stored in vesicles. They will travel over to the plasma membrane of the synaptic cleft, travel across. It releases the neurotransmitter by exocytosis, and the neurotransmitter then binds to the postsynaptic neuron, on its receptor, and it'll exert an effect on that receptor. Okay, here it is in a little more detail. So it begins with a sodium channel that will depolarize the presynaptic neuron, meaning it lets positive charges come into it. Once this depolarization wave reaches the axon terminal, this part here is shaped like a button, the voltage-gated calcium channels will open. Then calcium will enter into the axon terminal. The increased cytoplasm calcium causes the neurotransmitter vesicles to travel to the plasma membrane, merge with it, and release their neurotransmitter. Neurotransmitter diffuses across. Okay, so I'm going to go into a lot more detail about that, but what I just talked about in neuron, that's sort of like the foundation of it all. And here's the point I'm going to make right in the beginning. It's difficult to be in a good mood when your brain is short of oxygen, hypoxic, when your brain is short of glucose, hypoglycemic, when your brain is overstimulated by methylphenidate, amphetamines, or other stimulants, or when your brain is inhibited from making energy, like mitochondrial inhibitors. And all of these things are common situations. Okay, so when we talk about the brain and emotions, emotions are relatively transient, minutes to hours. Moods are longer lasting, hours to days. And then a personality is sort of, a longer lasting version of moods from years to decades. So what causes anxiety and depression or insomnia? It'll be a life event in a lot of cases. A person's reacting to something as a person would. But the reaction can be exaggerated if the brain is not feeling so well for all those other reasons we just talked about. So I'm going to talk about some of the things that overstimulate the brain and some of them that inhibit brain energy production. So what causes depression? And it is kind of similar. You'd be surprised how much overlap there is between depression and anxiety. And a lot of these patients have sleep problems as well. Your brain cleans itself at night when it sleeps. So if you can't get enough sleep, your brain's not able to clean itself and it leaves you kind of stressed out. Sleep deprivation manifests just like psychological stress. They both elevate the same hormones, cortisol and catecholamines. The catecholamines are adrenaline and noradrenaline. Caffeine does the same thing. That's why I say caffeine, coffee, tea, I think it's for chumps. Okay, I know you've been told it's good for you. It's all nonsense, corporate advertising, and nothing's good for you that's going to elevate cortisol and catecholamines. Cortisol is the hormone of the stress system. I'll talk in more detail about cortisol in just a moment. Okay, so things that can make you depressed. It could be a sad life event. Your significant other, your boyfriend, girlfriend breaks up with you. You're sad, you're disappointed. Everybody has setbacks and disappointments in their life, and that's normal. This guy, Thomas Shaz, he wrote a very interesting book called Myth of Mental Illness, how normal reactions to sad situations get exaggerated by the healthcare system as an excuse to put people on drugs. Okay, food theory. So food theory is sort of like what I'm talking about today, is that a bad diet will do all the things we talked about: decrease oxygen delivery to the brain, glucose availability, impaired energy production. So all of those things can decrease the kind of mood you're in. Can also cause brain fog if you have abnormal increased blood-brain barrier permeability. Genetic theory is to say it's partly genetic, and there is some truth in that. There are certain patterns you'll sometimes see in the family. Personality theory is saying some individuals are just predisposed to it for whatever the reason about their personality. Environmental theory, negative life events, certain environmental exposures to toxins depending on where you live. Like if you live under a power line, a little higher incidence of cancer. Religious theory, a person is happier when they think that life has meaning. You can take the same person. I've seen people who, became atheists and their life just fell apart. They became alcoholics, dropped out of medical school, all kinds of problems. So at least, religious people are healthier, much healthier. Harold Koning's book goes over that extensively because they got more hope. They believe that life has meaning. If you don't think life has any meaning, then why do anything? Why not just do the least possible? And it's also harder to tolerate suffering when you think it's just meaningless. Hormonal theory, like we talked about, reasons for excess cortisol. That also suppresses the formation of new neurons in the brain, neurogenesis. So if you can't make new neurons and you're shrinking your brain for other reasons, your brain's going to shrink at a faster rate. More rapid atrophy, it's going to make you stupid. Comorbidity theory, meaning that people are unhappy because they have some other disease. And some other diseases will affect the brain. If you got traumatic brain injury, that's a brain disease. If you're hypothyroid, that's going to decrease cognitive function, even though the problem initiated, let's say, in the thyroid. Okay. People could have some disease like autoimmune disease, rheumatoid arthritis, and they can't do things they enjoy because they have weakness and pain in their hands. That'll make them sad. Okay, monoamine theory. We're not going to get in that too much. And that's totally been exaggerated. The one neurotransmitter, one disease theory is mostly nonsense. Okay, then there's something called the cytokine inflammation theory. And this is based on the idea of sickness behavior. The idea that sickness behavior is sort of built into humans and other animals, that because our ancestors often died from infections. So sickness behavior means a person feels sick and they want to go off by themselves and take a nap and hopefully recover when they take a nap. And what they're doing is they're separating themselves from the rest of the group. And by separating themselves from the rest of the group, if they have an infection causing them to be sick, they're less likely to spread that to the other members of their family, their friends, their social circle. And that's thought to have a evolutionarily protective benefit. And so the relevance, though, is if somebody has chronic low-grade brain inflammation for whatever the reason, that might cause them to, develop the phenotype, the appearance of sickness behavior. So what they're saying is you want to avoid things that cause brain inflammation because they can push you into this sickness behavior where you seem like you're depressed and you really might be systemically sick. Okay, here's a little bit about more detail on a synapse in the brain. This would be a serotonin synapse. Serotonin in its neurotransmitter vesicles joins with the plasma membrane of the synaptic cleft, and then the neurotransmitter diffuses across the cleft, binds to a receptor, serotonin receptor on the postsynaptic neuron. Then the serotonin is taken back up into the initial presynaptic neuron. So this is the reuptake. So that's real important, reuptake. And the relevance here is for the drug, most common drug used to treat depression nowadays is an SSRI. So selective serotonin reuptake inhibitor. So it'll block the reuptake. So it'll keep serotonin in the synaptic cleft longer and create more of a synaptic effect. And this was the theory that was told to people, you have a neurotransmitter imbalance as the cause of your depression, but we're going to give you this drug, and that's going to increase the amount of serotonin in the synaptic cleft, so there'll be more activation of the postsynaptic neuron by serotonin, and that's going to make you feel better. That was a theory of neurotransmitters that was sold to the public in the 1980s and 1990s, but it turns out it's bogus. Okay, the neuron is going to compensate. For example, if you block reuptake for the drug, it's going to have more reuptake proteins, transmembrane proteins, to compensate for that. Sometimes the postsynaptic neuron will compensate by having fewer postsynaptic receptors. So what I'm trying to say is the brain cells, they're not passive. They will fight the drug and try to avoid whatever the drug is doing to them. And this can induce irreversible changes. Here's just showing the same thing with an antipsychotic medicine used to treat schizophrenia, for example. So AP is for antipsychotic, and you can get rid of some of the dopamine receptors on the postsynaptic neuron, but it compensates by making more of them. And the presynaptic neuron will store more neurotransmitter, dopamine in this case, in these vesicles. So the brain is not stagnant. It will fight the drug. And because of that, it's very hard to get a long-lasting true benefit. And then the other thing, too, is, in the model that is taught is always one presynaptic neuron and one postsynaptic neuron. But in real life, it's not like that. You'll have multiple different neurons interacting very close to each other, and they're modulating each other. So you can't just change one thing without a whole bunch of other things being affected. And that's why it's not that simple. Plus, there's corticosteroid effects. I'm going to talk a little bit more about corticosteroid effects in a moment, like cortisol, also increasing neurotransmitter release like glutamate. So anyways, it's like a symphony. It's not like 1 + 1 = 2. It's much, 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 much more complicated than that. Here's a guy by the name of Robert Whitaker. He wrote this really good book about the side effects of psychiatric medications. And he talked about how, the Ivy League doc who was one of the pioneers of treating attention deficit with these amphetamine drugs, he was getting millions of dollars from the drug companies, millions of dollars. He got money from 24 different drug companies. They love it. Okay, here's some guy who makes drug dealing to children respectable. Okay, if you were at a grade school and there was a drug dealer on the corner, you would say, look at that low-life scumbag drug dealer. Okay, get him away from here. Get him away from the school. Isn't this terrible? But when he comes from Harvard, they give him a medal and they give him millions of dollars. Okay, it's the same thing. So here's Robert Whitaker. After studying this for many years, he says, there's no proof that attention deficit even really exists. The American Psychiatric Association admitted in 1994 that Ritalin doesn't even work. The more drugs that kids get for attention deficit, the longer they're on them, the worse the outcome. All right. So here's this guy getting millions and millions of dollars, okay? From one place, he got $1.6 million in consulting fees. It's ridiculous, okay? Here's Bragan. He's a Harvard guy. This is the best psychiatrist who ever lived. And he said all psychiatric drugs cause brain damage, and they all are a chemical lobotomy. Electroconvulsive therapy is an electric lobotomy, okay? There it is. Okay, and he says also, the most important thing is the psychiatric doctor have a loving attitude towards the patient. See, people tell me, oh, I don't know what I'm talking about, that medicine's based on science. And they'll also say to me, how could you bring religion into it? How could you bring love into it? That's irrelevant. This is based on science. No, it's not. Because if the people who run in the show don't care about the patient, they're going to abuse the patient and rip them off, okay? And that's what's happening, and it's wrong. All right, now here's a lady, I guess psychiatrist, psychologist, and she says, are you ready for me to diagnose your totally normal reaction to our lousy society as a mental illness so I can get you addicted to mind-altering drugs for the rest of your life? That's what it comes down to. They can make a lot of money. And again, I don't want to talk too much about the drugs here, but I want to make it clear that, in my opinion, psychiatry is like probably the worst field in all of medicine. Here's this guy, James Davies, and he was talking about how the DSM, Diagnostic and Statistical Manual of Psychiatric Diagnoses, was written. And basically a couple psychiatrists got together and just agreed on stuff. And there wasn't really science-based, very little science behind it. And many of them had associations with the drug companies. So the thing's a big joke. This guy's the most famous scientist for studying whether or not things work. He's from the Cochrane collaboration. His name is Peter Gochke, and he's a super famous guy. He's a genius guy, and he studied psychiatry, and he came to the conclusion that the research psychiatrists are all in the pocket of the drug companies, that he says that we'd be better off if there were no psychiatric drugs at all. He says at least 98% of them should not be used. He says it's not popular to tell the truth in healthcare, but this is the truth. He says it's never been documented that psychiatric diseases themselves cause brain damage, but we know that the drugs do. They cause permanent brain damage, okay? We would be better off if there weren't any psychiatric drugs at all, okay? It's a lot hard for people to accept that, but it's true, okay? And I can also tell you something. My father was a psychiatrist, and he was a good man. He did the best he could, but he was kind of like most doctors. They're sort of conformist, all their life. They study, and then they're told this is what you're supposed to do, and it comes from the highest authorities in their field. And so they just conform to it, and they make a lot of money for following the standard of care. And people think doctors are so smart. They're not, okay? They're smart enough to memorize a bunch of stuff and get a decent grade on a test, and they're hard workers, but they're not innovative thinkers, okay? And most of them never read another book after they're done with med school. And what I mean by that is they don't go out there and search the journals and figure out what's really true. They practice what they're told coming from the Ivy League and the famous medical centers, and they'll just go with it. So Rip Van Winkle was a story by Irving about a guy who fell asleep for 20 years, and then he woke up and he noticed how much society had changed. And so what I'm saying is, nowadays, the big name universities, if they take a patient and they're not doing well from the psychiatric drugs, and maybe they don't do well from electroshock, they recommend them now to have surgery. They'll put an electrode into their brain. To me, it's insane, okay, doing surgery on a person's brain, okay, like this. Now, don't get me wrong, in Parkinson's, maybe at the end of the line with Parkinson's, but they're doing this now for depression, okay, in some patients. And to me, it's kind of crazy. So here's my little diagram of what's going on with psychiatry. The patient comes up to the receptionist and he says, oh, I'm so glad everything's based on science. And then the receptionist is like, or the psychiatrist, we've got lots of options of treatment. You can have a chemical lobotomy with drugs. You can have an electrical lobotomy with electroconvulsive therapy, which looks very much like an electric chair, as it should. Or you can have a surgical lobotomy. Or option number 4, run for your life, okay? And I realize sometimes people have an acute psychotic episode where maybe they do need Haldol or something, vitamin H, to calm them down. Okay, but long-term prognosis with these psych drugs is much, much worse than is widely recognized. So here's fluoxetine. That's the other name for Prozac. The flu comes from fluoride, and it's a mitochondrial inhibitor. Inhibits complex 4 of the electron transport chain in the intermitochondrial membrane. Okay, I'm going to talk more about intermitochondrial membrane here in a moment, but they say it has a tendency to injure mitochondria and cause apoptosis, cell death. And then here's a paper I found rather humorous. This paper in a cancer journal, oncology journal, it shows how Prozac will cause necrosis and cause cells to die. Calcium quickly accumulated in the mitochondria, leading to mitochondrial calcium overload and cell death. These results shed light on fluoxetine-induced cell death and its potential use in cancer treatment. So what I'm saying is, it's like giving a person chemotherapy. It's a poison. Okay, this was recommended as the greatest drug in the world. It goes back to that, that term, irrational exuberance, back in the 1980s and 1990s. People thought Prozac was the greatest drug in the world. And I can tell you, my dad was a psychiatrist. Everyone was talking about Prozac. My mother even said that, one of her friends was feeling kind of sad. So she gave her some of my dad's free samples for Prozac. And she's feeling so much better now. And I'm like, that was a crazy, irresponsible thing to do. But it was kind of funny. I know she meant well. But what I'm trying to say is that's what people thought it was. They thought it was like a piece of candy that makes you happy, a happy pill. Okay, but in reality, it's more like cancer chemotherapy. Luckily, people only took it briefly, many of them back in those days. But people who stay on it long term, it can do some serious brain damage. Okay, another thing that came up is something called soteria. Soteria is a Greek word for deliverance. And this has regard to schizophrenic patients. Lauren Mosher was like the head psychiatrist in all of the United States and the head research psychiatrist, the most prestigious position in all of the psychiatry jobs in the whole United States and therefore in the whole world. Okay. And he noticed that the schizophrenic patients did a lot better the less drugs they got. So he set up a program in California to have them sort of supervise in these halfway houses with people that weren't even psychiatrists or psychologists, just people who wanted to help out. Okay. So they had a residential living situation. And what he found was the patients who were schizophrenic that lived in one of these residential homes, about 85% of them were able to return to regular life, hold down a job, get married, raise children, versus of the ones that were treated with antipsychotic medications, only about 15% of them were able to have that type of a full return to society. So you'd say, okay, the guy did this incredible discovery with incredible results. He helped all these schizophrenic patients. What a magnificent improvement in good outcomes. Instead of 15%, he got 85% to have a good long-term outcome. They should celebrate him, give him a Nobel Prize. No, what did they do? They said, you are biased against drugs. He got fired. He got fired and discredited because he made the drugs look bad. That's how it works. That kind of thing happens all the time, over and over. All right, so just a little bit of stuff like what's the difference between an animal food and a plant food? Plant food basically has all the good stuff. Fiber protects the blood-brain barrier. Potassium, magnesium are vasodilators. Nitrate precursors are then made into nitric oxide vasodilators, so they open up arteries. That's good. They got antioxidants, which are the chemicals that prevent oxidative stress. And the way it works is, in a plant sitting in the middle of the field, let's say it's 100 degrees, sunshine on it, the plant can't do anything except sit in the middle of that field all day long. If it was an animal, a person, and they go, gee, it's hot outside, 100 degrees, they're going to go walk under a tree, get some shade. But because the plant can't walk, it has to sit there. It uses chemicals, antioxidants, to protect itself from the excessive heat of the sun. And when we eat the plant, we get the chemicals, the antioxidants. The animal himself has used them up, so you don't get hardly any from an animal food. Complex carbohydrates are the best food that the brain runs on. It's basically polymer glucose wrapped in fiber to make it a slow-release energy pill. All right, so now let's look at animal foods. The only good thing about, and when I talk about plant foods, I'm talking about low-fat organic plant foods. Okay, the only good thing about meat is that it's got vitamin B12. It's got more B12. Even though B12 comes from bacteria, there'll be more available in the meat that we get when we eat the meat. Okay, other than that, all these things are problems. High saturated fat is obesogenic, diabetogenic, and contributes to tissue hypoxia from blood sludge, rouleau formation. Animal protein, more leucine methionine, cause increased activation of mTOR, mammalian target of rapamycin, sort of like a building contractor getting ready to build a building, needs all its building materials available before it can build the building. Well, when there's more leucine and methionine, because the amino acid composition is different in animal protein, it has more of these things, you get more cell replication, which is bad. If you got cancer, it speeds up the growth of the cancer. But even for a person who doesn't have cancer, it accelerates cell replication such that they arrive at the Hayflick limit faster. Hayflick limit means that Hayflick was a molecular biologist working with human tissue culture. A chromosome has a telomere, like a shoelace plastic cap on the tip. And every time DNA polymerase gets ready to make a new copy of the chromosome with cell replication, it can't fully attach to the end of the chromosome. So the chromosome shortens. Now, what'll happen is it'll keep shortening that chromosome a little bit until it starts affecting genes that are needed for cell function. Then the cell will just die. So basically, you get about 60 cell divisions in your somatic body cells. That means your non-germ cell, your non-gonadal cells, and which is most of the cells in your body. And then the cell just dies. So basically, you want to slow that down. Slow down arrival at the hay-flick limit. They bioaccumulate herbicides and pesticides. They got more, intrinsic advanced glycation end products. Plus, they cause diabetes, creating more endogenous AGEs. Arachidonic acid is high, especially, let's say, in chicken and eggs, whereas you don't get that from plant foods, and that ends up being pro-inflammatory. It's an omega-6 fat. Estrogenics to fatten up the animal, because estrogen's a fat storage hormone. Save weight, gain weight, save it for the baby, might need it for energy. Heme iron is an oxidant, increase colon cancer, etc. High dietary sodium, often used to preserve it and to flavor it. You don't need to flavor a fruit and a vegetable. You just eat it. And I eat starches plain. A lot of people do, whereas you often need to put salt on meat. It's often fried. Xenosialitis is just because the sialic acids, let's say in beef, for example, are slightly different compared to human sialic acids. They're at the end of glycoproteins, so sort of the immune system identification card. So they're incorporated by the gut lining cells into our bodily tissues, but they're still recognized by the immune system as not really being as non-self, such that they elicit an autoimmune reaction. So you're going to get generalized systemic inflammation increase from that. You're also going to get leaky gut because there's no fiber. That's a big deal. There's no fiber in meat. So, and saturated fat tends to increase permeability of the gut. So when you get leaky gut, then you're predisposed to all your autoimmune diseases. That causes inflammation. You're predisposed to the bacterial endotoxins, LPS and LTA. LPS from gram-negative bacteria, LTA from gram-positive bacteria. LPS is lipopolysaccharide. LTA is lipoteichoic acid. And these are the bacterial endotoxins that get across the leaky gut. Leaky gut means increased intestinal permeability. And then they cause inflammation. They also change the shape of fibrinogen, the blood clotting protein, from being cylindrical, alpha helix, a secondary protein structure, to being beta-pleated sheet, flattened its secondary protein structure, and the flat stuff stacks up and it precipitates out of solution, which means to clot. So this is called amyloid clotting, amyloidogenic clotting. Douglas Kell and Etheresia Pretorius have written quite a lot about this. The relevance is you're forming these small clots in your blood. They're relatively difficult to lyse because they got a non-standard structure. They call them dense matted deposits. A regular clot looks very much like spaghetti, pieces of spaghetti. This is more matted and harder to, it's like the difference between combing your hair versus combing your hair when you got bubble gum in your hair, okay? So because of that, these little tiny clots can plug up small vessels in your brain and in your heart and decrease cardiac function, decrease brain function. It's not a good thing. And I also talked about leaky gut predisposing to autoimmune disease for other reasons. There's other bad things about meat. You can have viruses in the meat that can affect us because they're, getting into an animal, like bovine leukemia virus. You have more heterocyclic amines. There's more carnitine in meat, leading to more TMAO, trimethylamine oxide. That's atherogenic. Okay. And then even people think, oh, well, omega-3s are so good, you need to eat fish to get them. No, you don't. Fish is bad for you. People who tell you to eat fish is good, they don't know what they're talking about. They're either ignoramuses, liars, or chumps. Omega-3s are immunosuppressant. Plus, fish are very high in mercury. There's a whole book written about fish fog, cognitive impairment and dementia caused by fish. The author was Jane Hightower, an internal medicine. Okay. The bottom line is all the good stuff's in plant foods, and except for vitamin B12, all the bad stuff's in meat. So why would you want to eat it, All right, let me get back to my slide projection. Okay, so I'll go to the next slide here. Okay, dietary fiber. Short-chain fatty acids are used to maintain not only the gut barrier, but also the blood-brain barrier. Okay, so bottom line is if you don't get enough dietary fiber, you're not just putting yourself at risk for leaky gut, you're putting yourself at risk for leaky blood-brain barrier. And that can cause cognitive impairment, brain fog. Okay, and there's no fiber in animal foods. There's no fiber in oils, omega-6 cooking oils. These are just more papers showing that dietary fiber protects the blood-brain barrier. And you need to have an intact blood-brain barrier so you can maintain precise microenvironments for your neurons so they function effectively. They got very delicate electronic gradients, so they need a precise milieu, microenvironment. And they maintain that by having a blood-brain barrier because the blood fluctuates a lot after a meal. Tremendous shifts in chemicals. Okay, foods that are potentially have a negative effect on cognitive function and on mood. You got to get your sleep. So that's how your neurons clean themselves so they can function effectively. Having a psychological sense of purpose in life, whatever that is for the individual, that makes you more resilient. Religion can help, having, being loved by your family or whatever else, your boyfriend, girlfriend, husband, wife, all that stuff helps. Ability to focus on a task, to complete the duties of life. So people who sort of pick a few things and get good at them, they do pretty well. But a lot of people, they can't make up their mind what they want to do, and they're sort of not able to focus their energy, and it makes them kind of weak, saps their energy away. Now, the other thing, too, is like, how do you improve a brain? This guy, Michael Merzenich, he's a real smart scientist. He was a co-inventor of the cochlear implant to enable people to hear. And he said the way you improve a brain is you train it. You practice it, whatever you want to get good at. And how do you worsen performance? You add noise, which could also mean a lack of focus or distraction. You're not going to be able to study effectively if somebody's playing loud music, right next to you, or if the TV's on, for example. But anyways, that's a good basic concept. How do you get good at something? Train yourself to get good at it and tighten up your focus. Get your cell phone out of the room when you're studying, have it quiet, wear ear protectors, whatever it takes. Okay, causes of decreased brain blood flow. In the short term, high fat diets, especially sat fat, but omega-6 cooking oils are actually just as bad or worse. Excessive dietary sodium because it's a vasoconstrictor. Lack of potassium and magnesium, which, in animal foods and plant foods, these are high, the potassium and the magnesium, but there's a deficit of them with animal foods and processed foods. So all of these things are going to lead to decreased blood flow to tissues. Just having a real high-fat meal can drop oxygen delivery 15 to 20%. And normally we don't notice it because it's a sigmoidal-shaped hemoglobin-oxygen dissociation curve. But for somebody who's already a little bit compromised, that could be a big deal for them. Long-term, you can get chronic severe untreated hypertension will damage the arteries in the brain, causing atherosclerosis intracranial. So does diabetes, and that's going to cause brain tissue a mild relative hypoxia, okay, potentially more than just mild over time. If you overtreat hypertension with the drugs too much, which is a very common thing, you drop pressure down too low, and they don't get enough blood to the top of their brain. You can get little small deep white matter strokes. They sometimes call them silent strokes, meaning that they're not associated with a hemiplegic deficit, but they are associated with a progressive cognitive slowing. I see hundreds of those every day, by the way. Atrial fibrillation, congestive heart failure. There's lots of things causing decreased blood flow to the brain. Things that cause decreased oxygen in the brain. Obstructive sleep apnea, super common. Lots of people don't even know they have it. You put a pulse ox on their finger, they're dropping their oxygen saturations at night. And it's much worse, of course, if they're smoking cigarettes or they got, full-blown COPD, chronic obstructive pulmonary disease, messing around with opioids, etc. Metabolic decreased glucose delivery. A lot of diabetics take too much diabetes medicine, too much insulin at night. They used to only check, prick their finger about twice a day, maybe 3 times a day. But what they found out when they put continuous glucose monitors on them overnight was that they can drop their glucose quite a bit at night and be quite hypoglycemic. And that hypoglycemia at night, can you imagine you got a sleep apnea patient who's hypoxic, doesn't have enough oxygen at night because they're snoring, kind of closing down their airway, and then they don't have enough glucose going to those cells either because they gave themselves too much insulin dose. It's a common situation. They're going to be losing brain cells. I mean, there's a lot of reasons why diabetics have cognitive impairment. And what I'm trying to say here is when your brain is impaired, you're not able to get your brain cells to function well, that makes you unhappy. You're not happy when you can't think. You're going to be sad. Everybody's got problems in life. It's hard to deal with the problems of life if you are hypoxic and hypoglycemic. And what happens is all these problems start stacking on each other. Things that cause increased metabolic demand on a neuron because the neuron's overstimulated. Stimulants like from stress, from caffeine, sleep deprivation is the equivalent of stress. Increases cortisol, increases catecholamine. Adrenaline and noradrenaline are the catecholamines. But MSG, monosodium glutamate, manufactured free glutamate. I'll show you what manufactured free glutamate is in a minute, but it's just freeing up the individual glutamate. Glutamate's an amino acid, individual glutamate residues in a protein. Excessive sodium. Sodium will actually have a little bit of a sympathetic autonomic nervous system activation, which will also increase cortisol. So, and MSG and MFG, they also increase cortisol. I'll show you what that means in a moment, but there's a bit of a vicious cycle going on. So all of these things are overactivating your neuron. And this can make a person anxious. You're sort of idling. Let's say you're idling a car at a stoplight. That's what it is. They're just resting, but their brain's kind of hyperstimulated even while they're at rest. that can make a person anxious. And over time, that can make a person sad, frustrated, and depressed. Excessive psychological stress can even activate microglia, the macrophages, immune system cells of the brain. And the microglia can release glutamate for that reason. And this can then also add to the glutamate being piled up on top of these neurons that are overstimulated. So it's sort of like overstimulation as a mechanism. And the fancy word for it is called excitotoxicity. To excite a neuron is to activate it. And if you excite it too much, that's called excitotoxicity. And again, it's like overstimulation. It's a very common cause of neuronal injury. So let's see. We talked about the amphetamines for kids. There's certain drugs that will inhibit the reuptake out of the synapse, like HG will do that, mercury. Equivalents. And the things that will also mess up the neurons, the equivalent to increasing the metabolic demand, in a sense, is to decrease the ability to produce energy, meaning that you're going to put the cell in a difficult spot. So things that will inhibit that, you can have mitochondria inhibitors. I'll talk about those in a moment. SERCA inhibitors, sarcoplasm, endoplasmic reticulum, calcium ATPase. What that really means is there's an endoplasmic reticulum. It's a calcium storage site within the cytoplasm of the cell. It's an organelle, and it has a pump to pump calcium into it. The sarcoplasm word just is related to muscle. It doesn't really matter in a brain cell, but it's just left there because it's easier to say SERCA than to say ERCA. Excess BAP is beta amyloid protein. When you eat high-fat diets, you get insulin resistance. And so the pancreas cranks out more insulin, pushes it into the blood. The insulin is eventually cleared from the blood by something called insulin-degrading enzyme, IDE. Okay, but the insulin-degrading enzyme has higher affinity for the insulin than it does for the beta amyloid protein. And it can only be produced in fixed amounts, the insulin-degrading enzyme. So when you use up your insulin-degrading enzyme clearing out insulin because it's so high, you're less able to clear out the beta amyloid. And the beta amyloid will go from the periphery of the body. So the brain and the spinal cord is called the central nervous system. The rest of the body is called the periphery. Beta amyloid will re-enter the brain. So it goes from the periphery to the center. And it will then exert excitotoxic effect on brain cells. It can increase permeability to calcium of the NMDA receptor for glutamate. Aspartame is, in part made by aspartate, the amino acid. That's also an excitatory amino acid activating the NMDA receptor. The NMDA receptor is the one that allows calcium into a cell. Anything that increases cytoplasm calcium in a neuron activates that neuron. Okay, GP is glyphosate, glycine phosphate. That's a very common herbicide used on soy, for example. And it has a excitotoxic effect in the brain. The way you can remember that, I always call it glycine phosphate because that's essentially what it is. There's a little bit more to its chemical structure than that, but that's what it essentially is. Glycine is the smallest amino acid. It's also a co-agonist to bind the NMDA receptor. I'll show you pictures of that in just a moment. But it binds the NMDA receptor and contributes to increasing the activity of it, making it an excitotoxin. Okay, EMF opens up voltage-gated calcium channels, so it also contributes to excitotoxicity. Okay, causes of decreased energy production by mitochondria. There's lots of them. These are just some of the mitochondrial inhibitors. One quick thing about, why does high fat cause tissue hypoxia? Because the LDL cholesterol sticks the red blood cells together. It overcomes the zeta potential. Zeta potential is a normal negative charge on the periphery of a red blood cell. And so if you have a molecule with a positive charge on its periphery, but an adequate size, has to be kind of big, it'll function as a bridging molecule, meaning that it'll stick the red blood cells together. Once they're stuck together, they've aggregated, they then travel like a rouleau. A rouleau means stack of coins in French. Typical red blood cell is about 7 microns. Capillary is about 5 microns. So it has to deform itself to fit through the capillary. But when it's stuck to a bridging molecule, it becomes harder to do that. LDL cholesterol is a bridging molecule. That's why high cholesterol is a risk factor for atherosclerosis, actually the most common risk factor. IgM antibodies, acute phase antibody, they're real big, the IgMs, compared to the IgGs. So they're a bridging molecule. Fibrinogen, the blood clotting protein. Uric acid, which is elevated by eating meat, elevated by eating high fructose corn syrup in the blood. So here's the red blood cells going through this capillary. They're about 7 microns. RBCs, lumen is about 5 microns. So they got to deform themselves to fit through here. When they're all stuck together by these bridging molecules, it's harder to push them through. So the purpose of blood pressure is to pump blood to your brain. You have to pump it against gravity. But when your red bloods are all stuck together, you're pumping a milkshake instead of pumping normal blood that's like water. So you got to pump at a higher pressure. Okay, when the pressure goes up, it also means you're at increased risk to injure the blood vessels from the higher pressure. Okay, Normal blood flow is kind of laminar, like this diagram. This would be the red blood cells in the center. The white blood cells are these blue arrows, and then the plasma, just a liquid with, contains proteins in it, runs along adjacent to the endothelial cells of the artery. Okay, so this is normal laminar flow. That's what your blood vessels expect. All right, actually, I don't have my diagram today for turbulent flow, but when you hit the divider at a bifurcation point, it bounces off of it. And the harder it hits that divider, because the faster the velocity of that blood flow, the more likely it is to injure the vessel wall. We're not going to get into that more today, but that's why hypertension causes atherosclerosis, because it injures the vessel wall at bifurcations. Okay, this is just normal metabolism. Glucose comes into the cell. It's phosphorylated to keep it in there, runs through glycolysis, gets converted to pyruvate. Then it's sent into the mitochondrial matrix in here, undergoes Krebs cycle, and then electron carriers are generated from that. And then the electrons are passed along this inner mitochondrial membrane. So this is the mitochondria here. Mitochondrial matrix, inner mitochondrial membrane, and this is the outer mitochondrial membrane. So here's the OMM, outer mitochondrial membrane. Here's the IMM, inner mitochondrial membrane. And these are the complex proteins. These big ones here with the H plus going through them are the proton pumps. So here's the 3 proton pumps. And you're pumping protons into this intramembranous space. They create a gradient of proton concentration that's harvested by allowing one to come back into the mitochondrial matrix, going through this protein here, which is called ATP synthase. And the energy of that proton coming out, being freed up from its gradient, will enable this ATP synthase to spin, and it enables a phosphate to be connected to the ADP. AD is for diphosphate, 2 phosphates, and it becomes ATP, which has 3 phosphates. And that's the energy currency in a cell. That's like a $20 bill equivalent inside a cell to do work. Okay, briefly, here is a saturated fat. A saturated fat just means on the carbons, there's no double bonds. Okay, there's just all single bonds, carbon to carbon. Okay, the tail of just carbons is hydrophobic, nonpolar, not soluble in water. It's a little bit oil-like. The carboxylic acid at the other end of it, that is polar, meaning because there's unequal distribution of the electrons in these bonds, and that is soluble in water. And to have both features, to be polar and nonpolar in the same molecule, is called amphipathic. And what it really means is it's like an amphibian, like a frog can live on land and water. This molecule has a polar component and a nonpolar component. That also enables it to function like an emulsifier, a soap, or a detergent. We're not going to get into that all today, but you need to know with a sat fat, there's no double bonds. You need to know that. Okay, now here's the other types of fat. A MUFA is a monounsaturated fat, meaning there's one spot that's not sat. So it has one double bond. That'd be like olive oil is the classic prototype MUFA. And then here's PUFAs. PUFAs are polyunsaturated fats. Double bond at the 3 position is an omega-3. Double bond at the 6 position is an omega-6 fat. And whenever there's a second double bond, it's a PUFA. So that means there's 2 or more double bonds. There's going to be a skip carbon with no double bond on it. And that one's going to have a hydrogen that's not held tightly. This is called a methylene group, CH2. And there's always a methylene group between these double bonds. So what happens is this hydrogen is very high risk to be plucked off. It's also called the methylene bridge. Okay, actually, the other thing too, you hear omega all the time. Omega means the methyl end of the fatty acid, and you just count the number of carbons so you get to the double bond. So this double bond's at the omega at the 6 position, so this would be an omega-6 fat. If the double bond had been at the 3 position, from here to here, that would be an omega-3 fat. Okay. All right, so anyways, the methylene bridge hydrogen is a very high risk to be plucked off because it's not held tightly because the double bonds are sort of pulling away from it. And so what ends up happening is then you have an unpaired electron on the fatty acid tail there, and oxygen will bind to it. 2 oxygens in a row bound to each other and to the carbon molecules called a peroxide. And these peroxides are highly reactive and they're real toxic. They react with a lot of things and they damage them. They cause like chain reactions that can destroy membranes, for example. That's called, because it's a lipid, a fat is a lipid, it's called lipid peroxidation. And this is one of the reasons why you don't want to eat omega-6 fats. Never. I'd never eat anything with oil in it. I don't care what oil. I would never eat olive oil either. Another thing too, if you're overloaded on iron, as most Americans are, most men are overloaded with iron in their 20s. Most women become overloaded with iron sometime late in their 50s once they stop menstruating. If you get excessive free iron, that'll increase the risk of catalyzing something called a Fenton reaction. Fe for Fenton, Fe for iron. So what I'm trying to say is, The older you get, the more fragile you get, plus the more things there are happening in your body trying to destroy you, so to speak, to destroy your health. And so you want to know about them so you can avoid them. So, for example, what do? Whenever I go to do a blood test, I have them pull off a little extra blood to keep my serum ferritin level low. Ideal is about, having it in the ballpark of about 30 to 80. So mine, I didn't know when I was younger. I used to eat the high iron foods and high iron cereals because I thought that would make me strong like Popeye. And I never got out of the normal range, but I was high normal. Now I'm down to about 110. I used to be up to like around 270 something. Okay. So here's just examples of some things that are toxic to the inner mitochondrial membrane. These are real common. Lead's a common contaminant in a lot of things. F- in municipal tap water, hydroxynonenal from omega-6 cooking oils. Cadmium's a common toxin, including from car brake pads. GP, like we talked about on non-organic soy. And then I was also curious about mitochondria inhibitors because I went through my books, and in all my med school type books, my biochemistry books, I own like 7 biochemistry textbooks. I couldn't find anything on mitochondria inhibitors. I'm like, this is ridiculous. How come I can't find anything? I'm reading about them here and there in these isolated articles, but there's got to be more of them. So once I started going through all the papers, I quickly found over 50 mitochondria inhibitors, and they're really common. Wait till you hear this. You're going to kind of freak out. So remember, this is where most of your energy in your body is made. This is like about one of the most important parts of your entire body. What I'm trying to say is it's being poisoned and damaged left and right, nonstop all day long. Look how common these things are. We talked about GP spread on non-organic soy, which is basically used to make protein in almost all the processed foods. And then guess what? Atrazine is sprayed on almost all your non-organic corn. And that not only is highly estrogenic, that's the chemical that turns the female frog into the male frog. It's also an inhibitor of inner mitochondrial membrane complex 3. Okay, so it's a mitochondria inhibitor. It's a major toxic chemical. Okay, and we're just getting warmed up. F-, hydroxynonenal from the omega-6 cooking oils, the selective serotonin reuptake inhibitors, those antidepressants. Okay, what a disaster to inhibit your mitochondria. That'd be like one of the worst things you could do with a drug. And that's what it does. And that's supposed to help you make your brain better? No, it's stupid. Okay, HGs, inhibitor complex 1. What else? Metformin, the most common diabetes medicine. It's a toxin. It's a freaking toxin, okay? It's so funny. I had internal medicine friends, and they saw this, and they go, gosh, we're really giving patients a lot of bad drugs. I knew they were bad. I didn't realize they were that bad. I'm like, yeah, they are. Why don't you look it up? And some of my internal medicine friends are kind of funny. They're like, well, it makes me feel a little bad. We didn't realize we're giving the patients such bad drugs, but, what are you going to do? And they go, well, for the few ones that are able to learn, I'll tell them and try to help them. But look how common these things are. Lasix, a real common diuretic. Let's see, what else in here? Tylenol. Everybody's heard of Tylenol. That's a pretty common thing. Propofol is a pretty common sedative, like ICU patients on a ventilator or something for a procedure. PFOA from nonstick cookware. And then they always put antifungals into processed food because it's like a mold inhibitor. Mold inhibitors, they don't want mold growing in the processed food or it gets sent back to the company. Well, guess what? Very often they're mitochondria inhibitors. These common antibiotics, fluoroquinolones, beta-lactam, penicillins, aminoglycosides, they're all mitochondria inhibitors. Okay, so this is bad. People wonder why they don't have energy. Well, maybe it's because you're being poisoned for being an ignoramus. So now you know and avoid this stuff. Alcohol is toxic to Krebs cycle. Traumatic brain injury damages mitochondria as well. A lot of these heavy metals are real toxic to mitochondria. So it's a lot of stuff. I haven't even gone through it. TCE at the dry cleaner. That's why I don't go to dry cleaner anymore. I don't care if my clothes are wrinkled. I'll never go back. And then here, we talked about this before. This is basically a table of diets. Typical Western American eats really high-fat diets, so they plug up all their arteries and they're screwed for that reason. That also increases cancer. It also increases diabetes. Then you look at the East Asians, Japan, Korea, China, and they used to be relatively healthy with the white rice. And they were used to eat about 90% of their calories from white rice. What got them into trouble was they use very high sodium, 12 to 14 grams a day, especially like the Japanese. But they were also smoking a lot of cigarettes. So if they didn't smoke cigarettes, they'd be pretty healthy. They're actually one of the healthier populations in the world. What got them in trouble too, what sort of saved them also was, so they, first of all, there's only 1% of calories from fat in white rice, but also they ate a lot of vegetables and that helped protect them. The healthiest ones were Okinawa before they brought all the fast food places in there. Now they're fat and sick and stupid like everybody else. The Indian diet. You know, you meet a lot of Indians and they're usually pretty skinny. They look pretty healthy at first glance, but a lot of them have diabetes, have like type 1.5 diabetes. And my impression is it's from, I talked to a bunch of Indian, I have a bunch of Indian doctor friends, is it's from they have too much fried food. Some of them eat a lot of ghee and yogurt, you know, the dairy products, but it's mostly too much fried food, too much cooking with oil. And I actually have a friend, an Indian doctor friend. I hadn't seen him for like 6 months or something. And I'm like, hey, how you doing? Long time no see. And I go, where you been? And he goes to me, he goes, I was dead. I go, what do you mean you were dead? He said, no, I was dead. I had a heart attack. Oops, I tapped my microphone. He said, I had a heart attack, a myocardial infarction. I had to be defibrillated, resuscitated, but luckily I survived. Okay. And so I said to him, well, how could that be? You're a skinny guy and you're real hyper. You're always running around, working. You'd be the last guy I expect to have an MI. He goes, I don't know. Nobody knows what happened. I said, let me guess. Do you cook with oil? And he goes, of course, you have to. I go, no, you don't. I think that was the answer right there. Okay, now look at low fat, low sodium vegan with no oils. They have the lowest rate of all these diseases. Like I said, 1929, 1,800 consecutive admissions in Kenya, not a single person with hypertension. And USA, blacks have hypertension off the charts. Not before 1957 in Africa, not a single patient with rheumatoid arthritis. They very commonly have autoimmune disease in the USA. I think they're the most common population group, for example, that have lupus. You look at the Chinese. Before 1970, when they ate 90% of the calories from rice with only 1% of calories from fat, 1 billion out of 1 billion are skinny. The only fat guy I ever saw from China before 1970 was Bolo, you know, the guy who starred with Bruce Lee. And that's because he's taking steroids. He's probably eating like a sumo wrestler diet. Okay, what else? They couldn't find autoimmune disease, multiple sclerosis patient Roy Swank when he went to China about 1960. Okay, what I'm trying to say is epidemiology is very valuable. You know, you get these sample sets, 1 billion out of 1 billion. Okay, that's pretty convincing sample set. That's not a drug company, you know, 20 patients set up to make their drug look good. Okay, and here's a little bit of the toxins that are in your food. We're not going to go through all these. You can hit the print screen button and save this slide. But what I'm trying to show you is people are ingesting, you know, not just 1 or 2 toxins every day, but very often 10, 15, 20. And what I'm saying is it's hard to be healthy. It's hard to feel your best, to feel energetic and smart and clear-headed and optimistic when you're sort of being poked and prodded from 10 different directions inside your metabolism by all these toxic things. We talked about the things in the animal food. We talked about iron overload. We talked about the food companies cranking MSG, MFG into your food. They also put sodium in there because it tastes good. This stuff, MSG, MFG, it tastes good, so you eat more. Then they can sell you more. They make more money. Okay, we talked about soy has these toxic effects. It's estrogenic, goitrogenic. There's other problems with it. All these herbicides spread, especially on the non-organic food. All these heavy metals contaminating a lot of things, but especially fish, for example. Alcohol is a bad idea. All that stuff about 1 or 2 drinks a day being good for you, that's all nonsense. It's not good for you. It's best to have none. I talk about fungal inhibitors, estrogenics. We talk about omega-6. Omega-3 fats, in my opinion, are totally overrated. Okay, they're an immunosuppressant. Immunosuppressant means increased risk of cancer and of infection. In addition, omega-3 fats, they're going to make you fat. All fats make you fat, and they cause insulin resistance, so they increase your risk of diabetes. I think the story on omega-3 fats is quite overrated. I worry about lipid peroxidation with them as well. Okay, here's just some more toxins in the recent diet, including this stuff sprayed on avocados and being sprayed more and more on apples and some other things. I don't even know everything it's sprayed on. I did give a talk about it before, but it's hard to find information about it. I think it's much worse than people realize. I looked up the chem data sheets. It's much worse than people realize. It's not just trans fats. There's other things about it that are quite bad when you read through the allowed contaminants of it. And it's a fungal inhibitor. Go figure with that. We talked about estrogenics before. Caffeine is not good for you. I don't care what anybody says. Anything that cranks up cortisol, cranks up catecholamines, drops blood supply to your frontal lobes, that's not good for you. It also increases cytoplasmic calcium in your neurons, not even just through the glutamate mechanism. It actually has a unique mechanism of opening up through the endoplasmic reticulum, the rhinodine receptors. It allows calcium to exit the endoplasmic reticulum for an other reason. So it's bad on top of bad. That's why I don't drink anything with caffeine. The only time caffeine is good is if, look, let's say you got to drive home a long distance and you're exhausted and sleepy. Yeah, well then wake yourself up, okay? But other than that, it's not good for you. Okay, we talk about AL in your water. It's concentrated in tea plants. It can be concentrated in soy plants. And sometimes it's sprayed up in the sky. You know, the chem, you know what? You know, it can be in the trails. Not good for you. F- in your tap water and tons of drugs. Not good for you. even if topically it might have a small, tiny little benefit for teeth, there's no reason to ingest it. It doesn't belong anywhere in the body. It's the most electronegative element in the entire periodic table. It's a halogen. All the vertical items in the halogen part of the periodic table, they're all toxic. They all, chlorine's toxic. See how you sterilize water. Bromine's toxic. You sterilize a pool. All right, so anyways, here's the point of this. What I'm trying to say is a lot of people aren't sick. They don't have a mental illness. They're just being exposed to a whole bunch of toxins. And so the smart thing to do is learn what the toxins are and avoid them. That's kind of the whole point of this talk, is instead of saying, oh, poor me, I'm a victim, nothing I can do, I'm screwed, I was just born with bad genetics, I've got anxiety and depression or these other, attention deficit and all these other things. No, maybe you're just exposed to a lot of toxins and you have to learn how to avoid them. That's an important point. You're not hopeless and helpless and screwed. You can actually do something about it. It takes a little bit of effort, okay? Watch this video today, then play it again on slow speed at 0.75 and see what's relevant to you. You'd be amazed how much you can help yourself. Okay, so here is Ben Feingold. This guy was an allergist, and he figured out that lots of children were developing hyperactivity and poor behavior because of toxins in the processed food, especially the artificial food flavors and colors and preservatives. So here's his book, Why is Your Child Hyperactive? Okay, and here's another version of it, the Feingold Cookbook, for hyperactive children. And they have a YouTube channel, it's something like feingold.org, and they talk about all these toxic chemicals. So you see something like red number 40, yellow number 5, and you see it on like a candy flavored food, and everything looks so positive and so upbeat. You take a closer look at these things, most often they're made out of petroleum. Okay, these are big, and they're often these big, giant chemicals. These are just euphemisms to trick you into thinking this stuff is okay. And these preservatives can also often be quite toxic. So it's important to know that. And so the smart move is avoid all this stuff. My general advice is try to live like Adam and Eve, but keep your indoor heating and plumbing. Eat simple things that your ancestors could have eaten hundreds of years ago. You'll be a lot better off. All this modern processed stuff, it's all bad. So what it basically comes down to is you're like, all of us, our life, we're like the individual in a video game. And this is like Super Mario Brothers. And basically, if you do the things that are good for you, you get energy points. It enhances your life. If you do the stupid stuff, you eat the toxic food, you don't get your sleep, you lose energy points and you get weakened. And you want to be as strong and healthy as you can be, because sometimes bad things happen. You fall down, you could break a bone, okay? If I fall down, I'll put my hands out. I'll be a little bit embarrassed, but I'm fine. I get right back up. Old people fall down, they sometimes fracture a hip or get other types of fractures, and it's harder for them to recover. Significant number of patients who fracture a hip, they die. Okay, so what I'm trying to say is you want to build up some reserve. So for the inevitable setbacks, injuries, and whatever happens in life, you got the reserve to handle it. And you want to build your reserve as high as you can. Okay, typical thing is, the nitrates in plant foods, like especially your greens, they come in as a nitrate, NO3. The back of the tongue, there's bacteria, convert them to nitrite. That should be nitrite, NO2. And then it goes to the stomach. Stomach acid converts it to NO, nitric oxide, travels throughout the body as a systemic vasodilator. When you walk in the sunshine, you've got nitric oxide precursors that are released. So that's why it feels so good when you walk out in the sun. All these nitric oxide precursors suddenly released. This is why you don't want F- in your toothpaste or mouthwash or even your water, really. You can remove it with reverse osmosis filtration. At the very least, you want a carbon filter in your house water filter. You should have a whole house carbon water filter. Ideally, you can have an RO in your kitchen, or ideally live in a place where you don't have F- in your water. It's a brain toxin besides everything else. Okay, there's a lot of toxic stuff. You like protein powders. A lot of young guys think protein powders are going to make them stronger. They don't need protein powder. They just need to lift weights more if they want to get stronger faster. These protein powders are often very toxic. They got a lot of heavy metals. Here's a Consumer Reports article from 2018. They did other earlier ones like 2010, but this one they tested a whole bunch, 134 products, and they found detectable levels of a heavy metal in like all of them. And 55% even tested high for BPA, bisphenol A, the estrogenic chemical, which is kind of funny. All these things are associated with increased risk of brain damage. And you're not going to get stronger by inducing brain damage. Okay, so the protein powders are a bad idea. This is kind of funny. The chocolate often contain lead and cadmium, especially the dark chocolate and the cocoa or the cacao. So some people try to tell you chocolate's healthy. I don't think so.
Yeah,
Turmeric.
they actually the chocolate makers remove the cocoa butter and sell it to the cosmetic industry, and when they make the chocolate candy, they replace it with oil. They replace the cocoa butter with oil.
Yeah, it's there's a lot of games being played with this processed stuff. Turmeric, when it's sold as a powder, there's something called lead chromate, which is about the same color of yellow. So they mix that in to make it heavier to sell it. But the person who eats it, they're eating lead. They found that half of them had that when Consumer Reports tested them. This guy right here in food forensics, he's got a testing machine. He tested it, and he found a high incidence of lead in turmeric, in cilantro, in chlorella from some places.
And cinnamon.
And
cinnamon also.
Yeah, so
I try to really grind as much of my spices as I can.
Yeah, it's better to buy the cinnamon stick than the powder where they've potentially mixed lead into it. Here's a whole bunch of other stuff: ginger, oregano. Every single batch they tested was contaminated for ginger, oregano, and for thyme. The powders are especially dangerous, I think, because it's easier for the person who sells them to adulterate them. They want it to be heavier so they get more money. Here's cortisol. And the big thing you know about cortisol is it's the stress hormone. It basically is to mobilize resources of energy when you're stressed out. So for our ancestors, it was mostly a physical stress. And we remember that everything about stress you can remember by being chased by a tiger in the dark. So you got to get tons of glucose into your blood so you have all kinds of energy. You want some fat going in your blood that the non-essential parts of your body can run on fat. The brain needs to run on glucose. But you're just trying to climb a tree or something and survive the next 30 minutes. Okay, it makes you hyper alert, so hyper vigilant. That can cause insomnia. You retain sodium in your kidneys to add osmolarity to increase your blood volume, okay? But that causes hypertension. And in the modern world, a lot of times we don't have a 30-minute physical stress. What we've got is chronic psychological stress, often day after day. So what that means is chronically hypertension. You don't want cortisol chronically elevated. It's bad for you. It does all kinds of things. Osteoporosis contributes to. It overactivates your brain cells because it causes more glutamate release in the hippocampus. That's important to know. You need to know that. Cortisol causes more glutamate release in the hippocampus. Glutamate is the excitatory neurotransmitter. It's about 90% of cerebral cortex neurotransmitters are glutamate, and it is always excitatory. You need to know that because there's things that are increasing it, and you run the risk of overstimulating the person's brain. Very, very common. It does all kinds of bad things. It makes you weak. You don't want it. Suppresses your immune system, increases your risk of cancer, increases your risk of infection. Cortisol binds to the axon terminal and it stimulates the release of the glutamate. So that's how cortisol will increase its effect. And then sleep deprivation and caffeine are stress equivalents. So they do the same thing. Okay. Voltage gated calcium channel, we talked about how that normally is activated by the axon potential coming through, but it's also activated by EMF. The glutamate binds the postsynaptic receptors, activates the postsynaptic neuron. This is the astrocyte, sort of the support cell. They sometimes call these the mama cell. So here's neuron number one, the presynaptic, releasing its neurotransmitter. Neuron number two, the recipient of the signal. And then this is the astrocyte, the support cell, and it does additional good things. We'll talk about that later if we got time. Food companies know that they got to get the person to love the food, the taste of it, to get them addicted if possible, so they'll buy more of it. And they titrate. They use a test audience for research to get just the right amount of glutamate in there, the right amount of salt, the right mouth texture, the right amount of fat, the right amount of sweetener with high fructose corn syrup, for example, to reach what's called the bliss point, the ultimate pleasure and taste. They call these foods hyper-palatable processed foods. And the people become addicted to them. That's why Jay's potato chips used to say, bet you can't eat just one. Because they know from experience, from testing, they made it taste really, really, really good. It's unnaturally good. Okay, this lady wrote an interesting book, Catherine Reed. She's a PhD. Specialty is protein biochemistry. She got involved in food because her daughter had autism. And then she learned that MSG seems to worsen autism. So she started studying why is there so much glutamate in food. And what she found out very commonly, it's not even MSG anymore. Now it's something called MFG. MFG means manufactured free glutamate. So it's manufactured, done by industrial processing. It frees up glutamate. And here's the glutamate. So you start out with a protein that's high in glutamates. The G's stand for glutamates. Again, a protein is like a necklace, and the beads are the individual amino acids. They're all connected to each other. when you process the protein, you can heat it up, you can do all kinds of things to process it. You can chop it up with a blender, you can do other things. You then free up the individual glutamates. And then when you get a lot of these things freed up, they will bind the glutamate taste receptors in the mouth. The umami receptors are called, and the rest of the intestinal tract as well. Our ancestors worried about starving to death every day. So for them to get this big bolus of glutamate, it activates the reward neurotransmitters. The person's like, yes, this tastes great. I love this food. Okay. They especially make it out of gluten. Gluten is called gluten because it has a lot of glutamate in it. Every fourth residue is a glutamate. Casein in milk also has tons of glutamate, but soy is very high in it, and so is whey protein. And corn's real cheap, so they often make it out of corn nowadays anyway. So anyways, all this free glutamate tastes really good. People get addicted to the food. You can take some crappy old food and you stick all these glutamates in there and people will think it's fresh. So it also helps the food companies make tons of money. That's why they're never going to get rid of it. They're always going to hide it in the food. You can bet on that. That's why I only eat single ingredient foods, because they're not allowed to put it in there if there's only one ingredient. If there's a second ingredient, they can hide MSG in there and not even tell you. You usually see it though when you look at the wrapper and you read the nutrients. Things are like isolated vegetable protein, hydrolyzed vegetable protein, carrageenan, natural flavors, citric acid. These are all code names to kind of sneak a little bit of MSG in there or sneak a little glutamate in there, manufacturer-free glutamate. Whenever it says extract, malt extract, barley malt extract, et cetera, et cetera. Okay, this is an interesting book about a research study. What was interesting about it was monosodium glutamate caused increased plasma cortisol. So that's actually a big statement. If you understand the significance of the statement, that's actually an AO, an academic orgasm, okay? Because what it means is that it's not just cortisol increasing glutamate, but glutamate's increasing cortisol. And now you've got a vicious cycle, meaning of the potential for things to spiral out of control. I'll show you a little bit more about what that means in a moment. Okay, excessive dietary sodium will also have a sympathoexcitatory effect. What that means is it activates the fight or flight stress system, the sympathetic autonomic nervous system. I usually refer to it as SANS, S-A-N-S, sympathetic autonomic nervous system, which just means the stress response. Okay, and that's going to increase glutamate in your brain. So what I'm saying is two harmless things. Processed foods got tons of sodium. Processed foods got tons of glutamate. You're now going to be ramping up your cortisol in this way, and then you chase it down with a cup of coffee or a soda pop full of caffeine. That's a giant glutamate bolus coming out of those neurons. Not good. It's a total setup for hyperstimulation of your neurons. You don't want that. Okay, in a cell, the way a cell works, its electrical power system is basically this potassium sodium ATP pump. In a normal cell, it'll be about 1/3 of the energy. The entire energy of the cell goes to this pump. In a neuron, it'll be 1/2 to 2/3. So whenever a cell's putting all its energy into something, you know that's a big deal. It's basically the electrical system of the cell. And you know it's an electrical system because you got a charge separation on one side to the other. It's like a battery. You have current flow, meaning the charged ions moving across it. And you're able to separate them like a capacitor-like effect. So it's an electrical battery. All right. You need magnesium wherever there's ATP. The reason you need magnesium is ATP means adenosine triphosphate. So tri is 3 phosphates, which want to pull apart from each other because they got negative charges on each other, like two bronco buck horses trying to break away from each other. But the magnesium, with its positive charge, it hangs on to them. So you have to have magnesium. Most Americans are deficient in magnesium because it comes from plants. Magnesium is right in the center of chlorophyll. And because they're deficient in magnesium, they're less likely to have all these pumps working at 100% efficiency. So you need magnesium at these ATP pumps for potassium and sodium. You're pumping in 2 positive charges of potassium and you're pumping out 3 positive charges of sodium. And because you're pumping out more positive charge, you develop a slight negative charge on the inner surface of the membrane, negative 65 millivolts. And that attracts positive charges to want to come in. You can couple the entry of something like sodium. It's also 10 times higher in concentration outside the cell than inside the cell. So you can couple that to something else to do useful work. For example, to pump calcium out of the cell. Because it all comes down to calcium. If you want to talk about ions in a cell, calcium is the aristocrat, the boss of the bosses, okay? Calcium comes into the cell and says, now, go, release the neurotransmitter. It just orders everything else around. So calcium is what controls things. Potassium, sodium, magnesium, they're like the minimum wage workers that are just trying to get stuff done, okay? But everything depends on what's going on with calcium. So when a cell is active, calcium comes in, neurotransmitter is released. That's what a neuron does. However, the neuron has to be able to shut off very quickly. And so in order to shut off, it has to then pump the calcium out very fast. This knockout exchanger is incredible. It can pump out thousands of calciums in 1 second. It's like a miracle. It's so brilliantly designed, okay? People say, oh, doesn't studying science make you not believe in God? No, it makes me believe in God more because it's so incredible. It's not even funny. The smartest humans that existed ever in the history of the planet devote their entire life to understand one little thing in a cell, whereas a cell does millions of things at that level of complexity that no one can understand at all. All right, what you want is to have a K factor. A K factor means the ratio of potassium to sodium at least 5-to-1, based on the work of Richard Moore, devoted his whole life, 50 years, studying these ion pumps. Most Americans, they eat way too much sodium, not enough potassium, and it messes up their plasma membrane ionic gradients, and it also leads to hypertension and other problems. But I'm just letting you know that's the main reason why people are hypertensive. Too much dietary fat, too much dietary sodium, not enough potassium, because potassium comes from plants. P for plant, P for potassium. This is an old picture of all roads lead to Rome. And what I'm trying to say, when you talk about neuron physiology and health and problems, all roads lead to calcium. All kinds of things. Lack of oxygen, hypoxia, causes increased cytoplasmic calcium. Circuit inhibitors, mitochondria inhibitors, traumatic brain injury, EMF, okay, stress, sleep, caffeine, increased calcium in the cytoplasm. There can be different reasons, but they're all increasing cytoplasmic calcium, and you don't want that. They're all overstimulating the brain. This can lead to autistic behavior of autism in children that are vulnerable and predisposed. This can lead to anxiety. This can lead to brain fog. This can lead to psychological stress. So what I'm trying to say is food has a major effect on mood. Tons of those things I just showed you come from food, mitochondrial inhibitors. Anything that smells bad tends to be a circuit inhibitor. The high fat and the high sodium can cause tissue ischemia, vasoconstriction, sympathetic autonomic nervous system activation from excessive dietary sodium and from the MFG. Aspartame is an excitotoxin. It's an excitatory amino acid. GP, an excitatory amino acid. The glue itself, from MSG, MFG, an excitatory amino acid. All right, the aspartate, well, that's really aspartame. All right, other stimulants, tobacco, cocaine. So they're all bad. All right, and in order to get that calcium out of the cytoplasm, we talked about the knockout exchanger. Na is for sodium, Ka is for calcium, and that's coupled to the energy from the ATP pump. But you can also pump it into the endoplasmic reticulum here with the circle pump. You can also pump it with, this is a slow pump, the plasma membrane calcium ATP is, but they all require ATP. You always need ATP because you're always pumping against the gradient. The concentration of calcium outside the cell is like 15,000 times higher than it is inside the cell. So you're always going to need ATP energy to pump against that gradient. And that's a big deal because you always need ATP energy. What that means is you always need good mitochondrial function to make all this ATP. It's a lot of ATP. Okay. You can have thousands of mitochondria in a cell because they got to make tons and tons of ATP. All right, well, this just again shows cortisol will increase glutamate transmission, the normal process activating voltage-gated calcium channels. You've also got then the astrocyte. What it does is that after the cell has exerted its effect, it takes up the glutamate from the synapse, takes it into the astrocyte here, the tripartite synapse, 1, 2, 3 brain cells. And then it converts it into glutamine. Glutamine is harmless, so it can send it outside the cells into the extracellular matrix. And then it travels back to the initial presynaptic neuron. It's converted back to glutamate. Okay, and that's called the glutamate-glutamine cycle. And it's run by the astrocyte, the supporting cell. They call these the mama cells because they take care of the neurons. Okay, but here's what I thought was really interesting. Because this MSG, MFG, glutamate, excessive dietary glutamate is feeding in to the system to elevate cortisol, and cortisol elevates glutamate, you see how you can get a vicious cycle going here? Cortisol increases glutamate, glutamate increases cortisol, cortisol increases glutamate. When you start getting vicious cycles going, that's where the body has more of a chance to ramp itself off into serious disease and pathology. So what's the smart thing to do? It's obvious. Stop ingesting all this stuff. Avoid the processed food. I mean, nothing could be more obvious than that. Learn to control your stress. Avoid caffeine. Get your sleep. And then you won't get your cortisol so high. You'll sleep better. Your brain will clean itself better. And you'll minimize your insomnia, your anxiety, your obesity, your diabetes type 2, your hypertension. It's all good. Your dietary lipids, because cortisol cranks up blood glucose and free fatty acids. It totally predisposes to diabetes. And it makes you weak too. So guys feel sad when they're weak. They go to the weight room and they're like, I just can't get any stronger. Well, maybe it's because your cortisol is through the roof. All right. The opposite of cortisol, it's like a seesaw effect, is oxytocin. Oxytocin is the love hormone. So when you're around people who like you, love you, you feel secure. And that mellows you out. versus when you're around people who hate you and you're afraid they're going to hurt you, then you're stressed out. So that increases cortisol. The other opposite, cortisol is also opposite of melatonin. Melatonin is the sleep hormone. Cortisol is the be awake hormone. So anyways, getting your psychological attitude optimized also helps you to control your cortisol and not let it get so high out of control. There's other things that increase activation of the NMDA receptor. So here's glutamate, goes across to the postsynaptic neuron. It actually lets sodium in through the AMPA receptor first. That depolarizes the cell. Then once you depolarize the cell, meaning the charge in the postsynaptic neuron becomes more positive, now the magnesium that had been blocking the NMDA receptor is no longer attracted because you don't have a negative charge in here, or as negative of a charge. So the magnesium will bounce out. Magnesium normally blocks the NMDA receptor for glutamate. So when the magnesium bounces out, now the calcium can go through. But the point I'm making is lots of people are magnesium deficient because they don't eat enough plants. And because they're magnesium deficient, that means calcium easily can get through there. Okay. Other things that can activate the NMDA receptor, aspartate, we talked about that from aspartame, the artificial sweetener. Cysteine will be higher in a lot of animal foods. That can activate it. GP on the non-organic soy and non-organic. They also spray that on non-organic oats, non-organic beans. That's why for oats, for oatmeal, and for beans, I would make sure they're organic. BAP is beta amyloid protein. That'll also increase permeability of and excitability of the NMDA receptor. And you get that from eating the high-fat meals because they cause insulin resistance and then insulin-degrading enzymes tied up, clearing out the insulin, and it's not available to clear out the BAP, the beta amyloid protein. So anyways, these are just some of the ways. But the point I want you to get from this is that multiple things are adding up, conspiring to make you sick. And the only way you're going to win this game is if you avoid them. And so the way you avoid them is just being aware of them. It's pretty easy to avoid them. Just eat a low-fat plant-based diet that's organic and with no oils. And you avoid all that stuff. Only eat foods that have a single ingredient. Avoid stuff that's got apeel sprayed on, but that would be mostly like avocado. But I'd be careful about what apples you eat. Make sure you get them from a place that's not going to be spraying that stuff on them. Okay, here's a little mnemonic I made, Rosie. So Rosie is for Roger's theory. This is my theory of neurodegeneration. OGD is oxygen and glucose delivery. So that kind of carries into the dilatory theory, really. But he especially emphasizes oxygen delivery. But you get the point. That's the mouse equivalent stuff. I've talked about that before, meaning if you overtreat hypertension or if you have intracranial atherosclerosis, you don't deliver as much oxygen to the brain. Same thing if you got congestive heart failure, atrial fibrillation, aortic valve regurgitation, aortic valve stenosis. All right. If you're post-op hypotensive when you had an open heart surgery because they don't want you to bleed at urine anastomosis and they run you a low blood pressure, all of those things drop oxygen to the brain. Stimulants, things that increase the activity of neurons. So basically what you're talking about is you got a baseline metabolic rate in a neuron, and that has to be matched. I call it, this is the Peter Rogers, MD, supply and demand theory of neurodegeneration. So you have to match oxygen and glucose delivery to metabolic rate of the neuron. If you drop oxygen and glucose delivery, you overtreat hypertension, for example, or you got congestive heart failure, all those things I just talked about, you're going to have a hard time for this neuron to get enough oxygen and glucose to make ATP to meet its energy demands. But it gets much worse if you simultaneously take a stimulant. You're having the sodium and the MSG activating your cortisol. You're stressed out. You're sleep deprived. The glutamate and MSG themselves activating the postsynaptic neuron. Okay, you're having aspartame sweetener. You got GP on your processed food. You got BAP elevated because you're eating a high-fat diet. This metabolic rate is getting higher and higher and farther away from the oxygen and glucose delivery, the energy production capacity. And then worse, you start eating that processed food with the mitochondrial inhibitors from the fungal inhibitors. Now this gap gets bigger. The bigger this gap gets, the more likely these neurons are just going to go, and they're just going to die. So the stimulants are the equivalent of, like, imagine somebody having to work a triple shift every day. They can't keep that up for too long. And then if they stop eating enough food, they're just going to die, okay? So that's what happens to brain cells. When I look at brains, I've seen many thousands of brains, cognitively impaired and demented. I don't see the so-called characteristic pattern in Alzheimer's. I see diffuse atrophy, and I see it often in relatively young people. And so this is what's going on. And so, like I said, here, you just look at this slide. There's a whole bunch of things. You just hit the print screen button, avoid all these things, and then avoid the things where I showed you that one thing, toxins in your food, and you can dramatically lower your risk of becoming demented. We don't really got time to go into all this diabetes physiology. To avoid hypertension, avoid fat. Fat makes the red blood cells stick together. Avoid excess dietary sodium. Okay, it's pretty simple to do. Attention deficit, I would do everything like the Feingold diet and recommended. Avoid all this processed food. Only eat single ingredient foods that don't have preservatives in them, don't have anything bad sprayed on them. You can get a little more careful about it. To get into the whole diet for attention deficit, you can start doing a little bit of an elimination diet. Some people will talk about more things like avoiding corn and wheat. Some people are gluten sensitive. That's a whole other topic. I'm not going to get into all that. but just be aware of it. What makes you happier? Obviously, you get your sleep, you have a sense of purpose in life, you're around friends and family, you avoid the toxins, filter your water. Religious people are a lot healthier. I always go by the Schopenhauer quote. Schopenhauer said, "It's impossible for a man to have a happy life. The best that he can hope for is to have a heroic life." Meaning that if you feel that, my purpose in life is to do something, whatever that might be, and you pursue that goal, like let's say your goal is to be a good coach. Well, if you pursue the goal of being the best coach you could be, you respect yourself because you're doing what you should be doing, and that makes you happy that you respect yourself. So that makes you happy. I mean, there's a lot of things in life you can't control. There's a good quote by this one guy. He said, "You can neither make a person love you, nor can you make them tell you the truth." You can't control other people. You can't control the world, but you can control yourself within your own context. And if you control yourself well, you do what you should be doing, you like yourself. And so it's funny, but like I'll tell you, my kid said to me, he goes, "Dad, why are you so happy?" He said, "Out of all the people in the family, you have the worst life, but you're the happiest person." And I said, "It's because I know who I am, and I do what I believe I should be doing. That makes me happy." So anyways, there's a lot of truth in that psychological stuff. And you got to get it figured out for yourself. Because once you figure out, my purpose is to do this, whatever it might be, let's say to be a great teacher. And then when you do that thing, you're happy. You like yourself. You're spending your time doing what you want to do. You have a consistency between your conscious mind and your subconscious mind. And because they're both aligned, you got high energy and you're happy. And that's kind of what you want. I mean, you have to figure it all out for yourself, all the rest of the details, religion and all that other stuff. But that's a big secret of happiness. Okay. And anyways, that's what I got for today.
Oh, well, thank you so much. Everybody click like if you learned something today. I know I learned a lot of things today. And I appreciate all that you did, work that you put into the presentation. It was very helpful. Ava said, "Can you explain how dysbiosis in the gut microbiome might influence the development of mood disorders through its effect on neuron inflammation?"
Yeah, well, if you've got unhealthy bacteria in your gut, you're not going to get as much conversion of the fiber into the short chain fatty acids like the butyrate. That's a 4-carbon fatty acid. That is used by the gut lining cells to make the tight junctions. So you maintain the gut so it's not permeable. When you have an increased gut permeability, leaky gut, which you get from gut dysbiosis, meaning abnormal bacteria in the gut, you then will get the bacterial endotoxins coming through the gut wall. They're going to cause inflammation of the gut wall. It'll cause irritable bowel syndrome. It can cause inflammatory bowel syndrome. It can then spread in the blood, cause the blood, make it prothrombotic, all that stuff I referred to earlier about amyloid clotting. It increases the incidence of autoimmune disease because little chunks of protein from the animal food, they can get across the gut wall. The immune system reacts to them, forms antibodies to them, and those same antibodies can cross-react to the body's own protein. It doesn't happen to plant protein because it's different than ours, but an animal protein can be similar enough to ours, let's say to thyroid. You eat a hot dog, the thyroid from the animal then gets into our body, and it's atypical thyroid hormone. It'll form an antibody to it, then it'll cross-react to our own thyroid, Hashimoto's thyroiditis, Graves' thyroid toxicosis, and all that. So you protect yourself from autoimmune disease, you protect yourself from local inflammation, from systemic inflammation, and you protect yourself also from, like I said, amyloid clotting. The amyloid clotting is a problem. So you protect yourself in a lot of ways. Plus, even the bacteria themselves can get across the gut to some extent, and they can cause problems. They can also lay dormant inside your body and then become reactivated when the person starts developing iron overload with excessive free iron. Iron's like you want to think of like a fire. You want a fire in your house, for example, in the fireplace to keep you warm. You want a fire in the stove to cook your food, but you don't want it anywhere else. And so what I'm saying is people, when they eat these processed food, high meat diets, they chronically accumulate iron, and then it starts overwhelming their storage system. And it gets into the blood, and now you get synergistic problems. The free iron in the blood activates the bacteria to come out of dormancy and release their endotoxins into the blood. So you can get a lot of inflammation in that way. That's just some of the ways you get inflammation.
Karen said that she watched your lecture on my channel about osteoporosis. Can you ask Dr. Rogers if osteoporosis causes ALP enzymes to rise in the liver?
Now, I'm not sure of osteoporosis itself causing ALP enzymes. Not that I'm aware of, but I don't know. But I do know you can get elevation in ALK phosphate just from lifting weights. I forget the exact mechanism, but I know that'll elevate ALK phos. Because I had that years ago. I'm like, why is my ALK phos high? And they go, well, it's probably because you lift weights a lot. I never had any problems with it, and I just forgot about it. It was years ago. And I've heard that. So that's what I know about it. There might be more to it than that, but that's all I know about it. whenever I have an abnormal blood lab, like on a patient or somebody, what I do is I look up what's the differential diagnosis. And if you look that up on the internet, you usually find there'll be like 5 or 10 things that can do it. And then you look at most of them, 9 out of 10 are going to be like ridiculous and irrelevant. And then the ones that remain, that's maybe it. But a lot of times it's weird on the internet. They often don't mention the most important stuff. Like I just said, the most common reason probably you'll have alk phos might be just from lifting weights. But that's what I would do. I would check and see if you get something that seems like a reasonable match for the other possibilities, and check with your doctor.
Green Warrior, please click like to show your appreciation for what Dr. Rogers shared with us today. And Dr. Rogers, tell us about what you do and how we can find you on social media.
Oh, okay. Yeah. So on the internet, I have a YouTube channel. I'm on a few other video sites, but by far, most of my time at YouTube. YouTube has the best software, so it's kind of convenient. And basically, just as a hobby, I enjoy making these educational videos about nutrition and food primarily. I also have written a bunch of books. I wrote the book called The Medical Reformation, which I personally think, I'm a little biased, of course, is the best health, nutrition, medical book ever written. There's other really good ones too, of course. But yeah, and it's sort of like the way I came into all this stuff was, my kids are growing up. I had some free time, and I had been interested in a lot of these things for many, many years. And I myself had been fat, and then I became a low-fat vegan, got skinny again. But I noticed that all the medical books were wrong. They're all kind of a big joke. All the internal medicine textbook, internal medicine subspecialty textbooks are kind of a joke because they all say the same thing. Diseases are due to aging, genetics, occasional infections, and socioeconomic disparity. But it turns out to be nonsense because then you start looking at the papers and you're like, well, gee, no, they're due to mostly to diet and to toxins. And these are avoidable things. So anyways, they always say what I just said because then you can't control it and they can sell you drugs. So I'm like, wow, there's all this opportunity to help people. And at first I was all excited. I'm like, yeah, I'm going to be a billionaire. Everybody's going to love me. And then I realized all these people are like, I would rather die than stop eating meat. And then the healthcare system itself is like, hey, shut up. We don't get paid for that. Like I said, I've never, ever been invited by a physician ever to speak about this stuff. Not once. They would never invite me. And I've had my internal medicine friends tell me, they go, Pete, you're never going to be invited, ever. You're going to be kept out. And if you ever become better known, they're going to send more and more people out to discredit you. They're not going to ever let this become popular. It would be an insult to them. They would lose money from it. Forget about it. Your vegan nonsense, it's not going to go anywhere. He goes, of course, I want to know it for myself and my friends and my family and my few patients that are smart. He goes, but it's never going to become mainstream. So I think that's probably true.
Well, we're glad that you keep doing what you're doing because you're getting the information out to my Green Warriors and to people who come to your channel, and that's important. So at least we can take it upon ourselves to learn how to better control our health outcomes. And Dr. Rogers, thank you so much for sharing your invaluable insights on how food and lifestyle choices can profoundly impact our mood and our overall well-being.
Yeah, my pleasure.
Dr. Rogers, what's your final take-home message for our Green Warriors?
Yeah, well, if you want to be healthy, just look at all the things that make you sick and avoid them. And look at the things that make you healthy and do that.
Simple. Exactly. Well, Green Warrior, tell us what you're going to remember from today's presentation. One of my takeaways is the impact of brain-derived neurotrophic factor on the mood and how all these other things like exercise and social support can significantly influence our neurological well-being. It's amazing what we can do if we just get back to nature and do what our body's intended. I also wanted to thank Just Tess Voice. She did the countdown and the promos and the thumbnails, and she's getting all the message out there so that you guys can find out about us and come here and join us. And Just Tess Voice, tell us who is coming up next.
Bloating, straining, and fullness? Oh my. Angela Fischetti introduces gentle yoga for constipation, offering poses and relaxation techniques to help manage these challenges with ease. Wednesday, October 2nd, 3 p.m. Eastern, noon Pacific, on Be Green with Amy Live.
And I do want to thank you, Green Warrior, for joining us today. Your engagement and support make these discussions meaningful and impactful. And I hope you're feeling inspired to take a closer look at your food choices and make some positive changes for your mental health and well-being. And remember, every bite we take, it's an opportunity to nourish our bodies and become the healthiest versions of ourselves. And please stay tuned for more empowering content. Please subscribe to my channel and check out Dr. Rogers' channel as well, and share our message with others who you think can benefit, because together as green warriors, we can make a meaningful difference in the world. And as a special thank you to all of you, I'm offering you 5 free recipes, and they're whole food, plant-based, no added sugar, oil, or salt, and they do taste delicious. And I'll send them right to your inbox if you just go to begreenwithamy.com/join, and I'll get them right out to you. And I would like to invite everybody to join me and Dr. Rogers, and you can type in my tagline in the comments as Dr. Rogers helps me finish it up here. Are you ready, Dr. Rogers?
Yes.
Okay. Until I see all of you again, remember, be strong, be well, and be
green.
green. Thank you, Dr. Rogers. Thanks, Green Warriors. We'll see you soon.
Looking for really tasty recipes that are SOS-free? No sugar, oil, or salt. How can it taste good? Well, if you like flavor, then you'll love this Be Green with Amy recipe ebook. Get your copy today. Click on the link in the show notes. Be strong, be well, and be green.